I'm Amanda PK. Welcome to this series on Neuroimmunology Nuggets. Neuroimmunology Nuggets is an educational program that was developed with patients in mind to provide a focused or digestible topic in neuroimmunology and autoimmune neurology. For this episode of Neuroimmunology Nuggets, we will be discussing neurosarcoidosis.
So, in order to talk about neurosarcoidosis, let's take a step back and discuss what is sarcoidosis. This is an inflammatory disease that affects any part of the body, most commonly the lungs, but can involve skin, eyes, heart, lymph nodes, joints, as well as the nervous system. The inflammation results in granulomas, or clusters of white blood cells that include macrophages and other types of immune cells that form and deposit in various areas of the body. Granulomas can be formed by an infection, with the most notorious example being tuberculosis, but can also be formed due to an unknown trigger, such as sarcoid. Once this is triggered, you get a collection of these white blood cells, often macrophages, as well as other immune cells, such as T cells, that cluster together, as seen here in the middle. Over time, this becomes chronic, and you get this fibrous capsule surrounding this cluster of immune cells, and this makes a granuloma. Here in this picture, we see an example of a body PET scan showing bright areas, also known as hypermetabolic areas, of these granulomas. This is a patient with neurosarcoidosis as well as systemic sarcoidosis affecting many different areas of the body. Here you can see the liver. It has this speckled yellow pattern. It's supposed to be one solid color. These are granulomas within the liver. At the white arrow here, you can see this bright yellow spot that should not be here. That is a granulomas affecting the spinal cord and causing inflammation. And then in this picture here, these black areas are the lungs, and all these bright areas within the lungs are granulomas affecting both the lung and the lymph nodes surrounding the lung. In order to confirm the diagnosis of sarcoidosis, you need to have a biopsy and evidence of these granulomas on this tissue biopsy. Sarcoidosis is described as non-necrotizing granulomas, and it's important that you make sure to rule out other diseases that can cause granulomas outside of sarcoidosis, and that includes tuberculosis or other types of mycobacterial infections, fungal infections, and then other autoimmune diseases, such as granulomatous with polyangiitis, which is a type of vasculitis caused by a rheumatologic disease, and chronic granulomas of CVID, or combined variable immunodeficiency. So what part of the nervous system is affected by sarcoid? Well, really, it can be anything. The most common finding is a cranial neuropathy with a facial palsy, similar to a Bell's palsy, followed by inflammation on the surface of the brain, which can cause a meningitis. Blood vessels can be involved when you have inflammation of these blood vessels that causes a vasculitis or a stroke-like presentation. You can get pituitary lesions, which are quite common. And the pituitary gland in the brain is important for secreting hormones. One example would be thyroid hormone, which helps with thyroid function. Less common, you can get mass lesions that mimic tumors, although these are much more rare. If there is inflammation of the spinal cord, this is called a myelitis and can result in symptoms that include weakness, sensory changes, bowel and or bowel symptoms. The peripheral nervous system can be affected by this disease. And when you have the nerve roots and nerves exiting the spinal cord, as well as the communication between the nerve and the muscle, or the muscle, that all is defined as the peripheral nervous system. So when you have nerves involved, you can get peripheral neuropathies. When you have muscle involved, you can get inflammation of that muscle called myositis. There are specific diagnostic criteria for neurosarcoidosis. To make a diagnosis of definitive neurosarcoid, one must have a biopsy demonstrating that the nervous system is directly involved. For probable neurosarcoidosis, one must have a clinical syndrome that fits with neurosarcoid, as well as a tissue diagnosis of sarcoid somewhere else in the body. So for example, one might have a meningitis, but is found to have a lymph node in the lung or the chest that is biopsy and confirms sarcoidosis. If a biopsy is not possible or non-diagnostic, then the diagnosis may remain as possible neurosarcoidosis. Other tests that can be helpful in the diagnosis include spinal fluid studies or CSF studies. They often include things like elevated protein, elevation in white blood cells called a lymphocytic pleocytosis, and less commonly positive oligoclonal bands. However, in 30% of cases, the spinal fluid might be completely normal. We don't have a specific spinal fluid test that will definitively diagnose sarcoid. As I said before, it requires this tissue diagnosis and putting it together with the rest of the pieces of the puzzle on the neurologic presentation. Systemic imaging can be helpful. So this includes imaging of the body, such as a CAT scan of the chest or a full body PET scan. And what we do here is look for sarcoidosis somewhere else in the body that is easier to biopsy than the brain and obviously the spinal cord. In terms of treatment, steroids are often used as early first-line therapy. We often use IV steroids followed by a long oral prolonged taper. Unfortunately, when the brain and spinal cord are affected, steroids are often not enough. Long-term use of steroids comes with many side effects, including osteoporosis, where we see weakening of the bones, diabetes, there's increased risk of infection, as well as thinning of the skin and poor wound healing, which can lead to bruising. So we really try to avoid these medications long-term if we can. And by doing that, we start something called a steroid-sparing agent. So we don't have to continue the steroids for a long time. Often with neurologic involvement, we will use a medication called infliximab, which is a TNF alpha inhibitor, which stands for tumor necrosis factor. And the way this works is that this inhibits the formation of these granulomas. There have been prior multi-center retrospective trials showing a benefit with this medication in neurosarcoid. These are two of those studies where they saw 70% remission of neurosarcoid in a group of 28 patients, and another study that was multi-institutional that showed improvement in 77% of patients. And that was out of a group of 66 patients. And with that, I would like to thank you for tuning in on this edition of Neurosarcoidosis in our Neuroimmunology Nuggets.